Alameda Health System, Highland Hospital in particular, where our educational programs are housed, is a wealth of clinical training opportunities.
It's an amazing program. We're one of the oldest programs, not only in California, but the entire nation.
Residency training at Alameda Health System truly is a group that comes together. No matter where a patient's from, no matter what social or financial background they come from, every patient gets seen, and that becomes part of the training program and part of the suite of education that our residents learn from.
I think when you're in residency, you want to try to experience as much as you can during your training to prepare you to have a career in your profession. And we have a wealth of different pathologies that come in all different stages of presentation, all different levels of acuity, from walk-in clinics to, the level 1 trauma center. So it's just a great opportunity to get exposed to as much as you can during your training years.
What's fantastic is just the people. And we have really dedicated faculty who are at the top of their game and really care. It's a small group, but that just means that we know each other on a more intimate basis, and the residents get to know us. We get to know the residents very well.
When I was younger at Highland, my uncle got sick and he had a pretty severe illness, and I was really impressed by the residents and healthcare workers who took care of him. From that experience, I just thought it would be best to train here and become the best physician I could be.
A lot of people know that Highland Emergency Medicine is a very renowned program, and I think that part speaks for itself. But I'm from the Bay Area originally, and something that I've always wanted is to be close to home and kind of serve the community that served me when I was younger. And so that was like a big factor. But the fact that this is a county kind of system and the patient population that we serve are very vulnerable, it makes me feel like the work that we do is that much more important and can change the patient's life so much more.
We have the most diverse patient population I think I've seen across the board in healthcare systems. We have, I would say, hundreds of languages that we go through. We have to use interpreters daily to talk to our patients.
As a Black female physician, being able to be represented in that space, I know it has such a huge impact on my patients of color. They often see me and they're surprised that I'm their doctor. And that truly just makes my day.
This is a place where people are going to see a lot of diversity in terms of clinical presentations, infectious diseases perhaps that you're not going to really see a lot of times in the US. Our patients are folks that are coming from historically marginalized backgrounds and are vulnerable and have a lot of need. And that combination of medical and social complexity makes it so that our folks have training that's really comprehensive. And so that when they finish their 3 years, they go out. A lot of alumni have told me that their jobs, on leaving Highland has been sort of easy by comparison, which is what you want to hear.
Our residents, when they graduate from this program, they can practice anywhere. We have our residents go to university-based care centers, managed care centers. They go to different types of community emergency departments. And in addition, we have a lot of agreements with Indian Health Services, for instance. So a really robust training in rural health, if that is what our residents choose to do.
I think Highland does select people who are for the mission. And so you do have a lot of like-minded individuals. And so in that sense, we do bond.
The qualities of a resident that would thrive in our program is, I think, someone who's open to new opportunities and really embrace a rich training environment, who really wants to be that frontline person, get first crack at patients. We try to put you in the position that you get first dibs on the patient, so that you can really start to hone your skills in history taking, your physical exam, thinking about a differential, and ordering the appropriate workup, in the safety net of having your attending physicians there to talk it over with and support you in your education.
Something that I would tell potential residents applying is just to apply. Come see us, come spend time with us. You won't regret a minute of it, and you'll only see how much we love and care for each other and our patients and everyone that we work with.
I would say it's probably the best decision that you'll make. It'll be a scary one, but you will definitely appreciate it in the long run.
Anywhere you go, residency is going to be a really tough experience, and it's going to be transformative. And so for me, what was really important to do was to be somewhere that I felt supported, which this place very much embodies, but also kind of have a balance between my independency for my ability to grow, and also have my hand held, because I really, at the beginning, don't know what I'm doing. I think Highland really strikes that balance, and that's something really incredible here.